My name is Dr. Holly Smith, and I have been a pediatrician for a little over 25 years. So here at Signature Pediatrics, we have time to spend with our patients, and we really pride ourselves on being able to have open communication with our patients. So whereas in many practices a patient calls and they talk to the receptionist, whose job is kind of to keep you from being able to talk to the doctor because the doctor's busy. Here at Signature Pediatrics, we have the patients call and speak directly to us, and that's true during the day and after hours. And as a doctor, I really like that open communication. There's no layer between me and the patient where things can get miscommunicated or there can be confusion. And our patients feel comfortable calling and asking us even small little questions. I think that our accessibility is what we pride ourselves on, and it's exceptional compared to the traditional pediatric practice. The other thing that helps us be very accessible is that we don't have any wait times. So when our patients come in for an appointment, they're usually greeted at the door and taken right back to the room. So they don't have to wait in the waiting room, they don't get exposed to other children who might be sick, and we're able to bring them right back and get started with their visit. One of the things I really like about Signature Pediatrics is the facilities and the ability that we have to do some medical care here that other practices may not have. So for instance, if a child is dehydrated, we can do IV fluids here, which saves them a trip to urgent care. We can also do some simple suturing and IV medications if they are needed. We have an x-ray facility here, which means we can have the x-rays taken and look at them right away, which can help speed up the process of figuring out what's best for the patient. And we also have lab services here. We have a pediatric nurse who can draw blood, and we can send the labs out and get results very quickly. And so all of that helps us coordinate the care for the patient without having to send them to another facility, which I think just provides better, consistent care for the patient. We also do quite a bit of telemedicine, and what I mean by that is our patients often email us, text us, they'll send us pictures of a rash, and by doing that, we again have great seamless communication with the patients, but we can also often save them an office visit. So many times a patient might send me a picture of a rash, and I'll be able to answer their question over the phone, and they do not have to come into the office. So by saving office visits and saving trips to urgent care, we can save the patient both time and money. So with our concierge pediatric model and the smaller number of patients that we see, we can establish very close relationships with our families so that when they come in, they're greeted by someone they know and they can feel very comfortable coming in, being seen right away. At Signature Pediatrics, we've tried to remove some of the hassle of going to the doctor so that you're able to get an appointment when you want it, not have to wait in the waiting room, and seeing people that you're very comfortable with, asking even silly little questions just to get the answers, and then we're able to reassure parents that way. I really enjoy being a pediatrician because we have the ability to watch children grow throughout their lifetime, and we work not only with the child but with the parents. One thing that I've learned is that from the time they're born, each child is very different, and I really enjoy looking at the differences between children and their different needs, and constantly learning new things every day because every child is different.